Good morning, my people. How are you today? It's me again, Auntie Abidok, your sister, your girl, your friend, your well-wisher. Um, Remember, this program is about talking to us about different types of diseases and what we can do to prevent it so that we will not have them. And if for any one of us that already have this type of medical issues, how we can quickly recognize that we've got them through our discussion on signs and symptoms, so that we can go and seek for medical help as soon as possible. The one we'll be talking about today, it's discussion on blood clots. We'll be discussing today about blood clots. Blood clot is also known as deep vein thrombosis. I'll repeat that. Deep vein thrombosis. We also call it DVT. DVT thrombosis occur when a blood clot forms in one of the deep veins of the body. Usually it happens in the legs, but sometimes it will happen in the arm. It's a blood clot. Some sort of clotting will happen. Instead of the blood floating normal, there will be a clot somewhere, and normally it happens in the leg, or sometimes it could happen in the arm. So, what are the signs and symptoms of DVT, deep vein thrombosis? All right, there are signs and symptoms, and they include: 1. Swelling, usually in one of the legs or in the arm that's affected. 2. Leg pains or tenderness. The leg will be so painful, and then it will be a lot tender. There will be a lot of tenderness in the leg. 3. Redness. You just find out that the part, whether it's the leg or it's the arm, is red, always red. 4. Skin discoloration. Skin discoloration. And again, that particular leg or arm that the clot has happened in, when you touch it, it will feel so warm. So it will be warm to touch. Okay, so what causes blood clot then? What causes blood clot? All right, we'll talk about some of them. So blood clot may occur because of the following. 1. If the flow of blood in the vein is very slow. I'll repeat it. If the flow of blood in the vein is very slow. 2. Immobility. And immobility could happen due to a couple of things. 1. Hospitalization. If someone is hospitalized, it could happen. That is admission to hospital. That's what I mean by hospitalization. 2. Being paralyzed can cause blood clots. C. Prolonged sitting can cause blood clots. D. Major surgery, especially surgery to the pelvic area or surgery to the abdomen, hip area, or to the knee. They can cause blood clots. And E. Bone fracture. or cast. Number 3, increased estrogen. Increased estrogen. And this could be A, by using birth control pills. When we control births, you know the pills that we use to control the births, and patches or rings. This is more applicable to women. When we try to control the birth by using all these sort of pills, it can cause blood clot. B, pregnancy can cause blood clot sometimes. C, estrogen and progesterone hormones therapy. Estrogen and progesterone hormone therapies can cause it. 4, medical conditions can cause blood clots. And this type of medical conditions includes 1, or let's say A, cancer and chemotherapy. 2, heart failure. 3, inflammatory disorder, i.e. like lupus. 4, kidney disorder. And other risk factors include previous blood clots. Previous blood clots. Previous blood clots can cause it. Also, family history of blood clots can cause it. Clotting disorder can cause blood clots. Obesity can cause blood clots. Older age is another risk factor. Cigarette smoking can cause blood clots. Varicose vein can cause blood clots. Okay, if those things can cause blood clots, what can we do to prevent blood clots? What can we do to prevent blood clots? The first one is to stay active. We need to stay active at all times. Immobility increases the risk of developing blood clots. So, if we have been sitting for a long period of time, we should stand up, stretch our legs, walk around,